Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our cancer awareness series, we have Dr. Guruprasad Bhat with us. Dr. Guruprasad Bhat is a medical oncologist and hemato-oncologist at Ashwini Polyclinic, Mangalore. For the past 11 years, he has been working in this field. Welcome to Medicircle, Dr. Guruprasad.
Welcome. Thank you, madam.
So, in India, blood cancer has been among one of the most common causes of death, within an incidence of over 1 lakh people being diagnosed every year with this type of cancer, such as lymphoma, leukemia, and multiple myeloma. So, doctor, my first question is that what exactly is blood cancer?
So cancer basically is anything which grows abnormally in numbers. So which grows without any control. So blood cancer basically arises from the bone marrow. That is where the blood production occurs. So as you already told, there are three types of blood cancers, commonly leukemias, lymphomas, and myeloma. When there is an abnormal production of these cells, we get a blood cancer. For example, red blood cells, what we commonly see in movies, it has a lifespan of around 120 days. If it starts living longer than that and the production keeps on increasing without any death, then we have a type of blood cancer there. So each cell has its own lifespan. WBC has its own lifespan, platelet have its own lifespan. So different cells from the bone marrow have different lifespan. Anything which doesn't uh, stop which doesn't stop its own production and go into its own death, then we have a blood cancer there.
So, like, what are the signs and symptoms of blood cancer?
The common signs and symptoms of blood cancer includes fever, chills, and they also have weight loss, easy fatigability, and depends on the types of cancer also. So if you have a lymphoma, the patients usually have swelling in the neck, the armpit, and the leg, or sometimes in the abdomen also. They have some small swellings there. Or depends on which type of cancer. So for example, if patient has blood cancer, they'll have small patches in their arms, the legs, which is because of excessive bleeding. These are called petechiae and purpuras. Sometimes patients also have joint pains because of excess production of blood in this bone, which they have excess joint pains. And sometimes they're misdiagnosed with joint pains. Usually children don't have any symptoms. Most common cancers occurs in these children, and they don't have symptoms. They usually complain of pain in the leg or hand, and vague symptoms there will be. Sometimes the easy fatigability, that is anemia, usually presents with easy fatigability. So these are some of the common symptoms, but each cancer has its own symptoms. Some of them are so slow growing that they may have no symptom whatsoever, and they may be picked up on a routine blood test.
So, doctor, like, what are the preventive measures to treat blood cancer?
Okay, the preventive measures per se is in general, which we say for all human beings, that is, have a regular healthy lifestyle, do regular exercise and things. But specific for blood cancer, we would say is to avoid exposure to radiation. Radiation can be in any form, that is in the form of I think excessive amount of radiation in the form of like we get yearly scans like CT scan unnecessarily if it is done, or PET scans and things like that. Unnecessary exposure to radiation can produce blood cancer. Sometimes chemicals like benzene also can produce blood cancer. Per se, there's not much of preventive aspects for blood cancer, but yeah, leading a healthy lifestyle reduces risk of most cancers, including blood cancer.
So, how do doctors treat blood cancer?
Okay, for us to diagnose and treat blood cancer, first we need to make a diagnosis of that it is something is blood cancer, because it is very difficult because the symptoms are pretty vague. They have easy fatigability, and they'll have weakness, they'll have joint pains, and they'll go to multiple places. They'll take some painkillers, and then they'll come to us. So the first thing is we do a general examination. That is, look for signs and symptoms. We look in the eyes for anemia, the hemoglobin being low. We look into the mouth, the oral cavity, whether the gums are hypoplasia is there, thickening. We look into the skin, looking for all this bleeding, signs of bleeding, which is there. We'll examine their abdomen. We examine their neck for the lymph nodes. Lymphoma is usually present with lymph nodes, or we examine the abdomen for liver and spleen enlargement. These are some of the things which we do on examination. Once we see these unusual signs, that is bleeding or lymph nodes, then we go ahead with further examination. Further tests include a simple test like a complete blood count, which includes CBC and peripheral smear, that is hemoglobin, total WBC count, platelet, and a peripheral smear. Sometimes we may need to do a lymph node biopsy. Once these basic tests suggest that there's something abnormal going on, we go ahead with more tests, that is for confirmation. That is a bone marrow aspiration and biopsy. This is the site where the blood is produced, so we always need a bone marrow aspiration biopsy. May not be needed in all cancer, but some cancers do need a bone marrow aspiration biopsy. Once a suspicion is high and once it is confirmed, we need to do further subclassification of these cancer for prognostication. They include a genetic test like FISH, IHC, PCR. Sometimes for acute leukemias, we need to do a flow cytometry. These are some of the higher end tests, but only once we have a basic confirmation that there's something abnormal going on in a bone marrow or a blood test, then we go ahead with these tests. So I think first step how to diagnose them is show to a doctor when you have these symptoms. They will some basic preliminary tests, examine you, they do some basic preliminary tests. Once they say something is abnormal happening in your body, the further tests can be suggested. It doesn't mean that all the patients need to undergo to all these tests, and only some of them are needed for some of the patients.
So, doctor, like, how serious is blood cancer?
Okay. Depends on what type of blood cancer. As you are already told, there are 100 different types of blood cancers, and commonly we divide them into three common subtypes: the leukemias, the lymphomas, and the myelomas. So depends on the stage of cancer. So there is something called staging for lymphomas. It can be the early stage, locally advanced stage. Hodgkin's lymphoma has such staging. Non-Hodgkin's lymphoma also has stage 1, 2, 3, 4. Similarly, myeloma has stage 1, 2, 3. Whereas in blood cancers, it can be acute or chronic. And acute leukemias again can be divided into AML and ALL. Why I'm telling all this is each cancer has its own prognosis. For example, a CLL, the patient will survive. Patient will take probably around 5 to 10 years before they even reach a diagnosis, from stage 0 to probably once they come to us for diagnosis. Low grade lymphomas will take 5 to 10 years before they come to us, whereas a high leukemias, acute leukemia in children, roughly they take around 15 days to 3 months. Within that time, they come to us with full blown symptoms and full blown cancers. So it depends on the subtype of cancer, depends on what stage they have been diagnosed. And this is the general staging. But then there's a molecular staging also. That is, if you have a follicular lymphoma, we'll do a genetic test, we'll do further subtype, or a DLBCL, we'll do further testing to know what subtype of cancer it is, to know the exact prognostication. For example, if you have acute leukemia, you have two children with acute leukemia, both may not have the same outcome, because some may have B cell leukemia, some have T cell leukemia, and they are two different diseases altogether. So and the genetic makeup may be totally different. So in general, if I'm trying to say, a Hodgkin's lymphoma, all stages combined, all stages, stage 1 has an excellent prognosis, stage 2, 3, 4, the prognosis comes down with the stage. Overall, Hodgkin's lymphoma has one of the good prognosis. Roughly around 88% of them can be cured irrespective of the stage. When you come to non-Hodgkin's lymphoma, it depends on what subtype of non-Hodgkin's lymphoma, whether it's aggressive or the intermediate type or the low grade type. And roughly around 75% of them can be cured. 73 to 75% of them can be cured in non-Hodgkin's lymphoma, especially the aggressive ones, the Burkitt's, the DLBCLs can be cured. In myeloma, again, the subtype makes a huge difference, whether it's ISS stage 1, 2, 3, or the molecular subtypes. And even in myeloma, roughly around 60% of them can be cured. It's not cured, can be controlled for 5 years, 10 years, 15 years, and things like that. So it depends on the cancer. depends on what stage it has been diagnosed, depends on what type of cancer, low grade, intermediate grade, high grade. Low grade cancer, the patient survives on his own for 10-15 years, and whenever they have symptoms, we treat them. So it depends on the cancer. So to summarize that how serious it is, we need to, because we are telling a whole lot of diseases together, it depends on what subtype of cancer you have, then we can definitely tell how serious it is and how good it is or how bad it is. But in general, blood cancers are better curable compared to all other cancers. For example, if you have a lung cancer or any other solid tumors, then the prognosis, 5-year survival is hardly 15%, whereas in lymphomas, it's Hodgkin's lymphoma, it's almost 88%. That means out of 100 you treat, almost 88% of them survive for 5 years in Hodgkin's lymphoma, whereas in blood cancers, only 15% of them, whereas in lung cancer, only 15%. So generally, it is a good cancer, but we need more awareness programs to help them diagnose them in early stage, pick them up, and get a better outcome with these.
So, Doctor, on Medicircle, our main focus have always been to provide the audience with large amount of information in less time. And so today we will be conducting a small question answer session in which you can answer in 1 or 2 line sentences.
Yes, madam.
So, like, can blood cancer patients live a normal life after the treatment?
Yes, they do live a normal life. We have seen patients coming with their children, giving marriage invitations and things. So they do lead a normal life.
So, does blood cancer spread very quickly?
Yeah, it depends on the subtype of cancer. So in general, if it is an acute leukemia, they spread pretty quickly, meaning they are pretty aggressive, whereas the chronic leukemias are pretty slow, CMLs are pretty slow, and the treatment is also pretty simple. For a CML, you just need a magic bullet called imatinib. So they do spread depending on the subtype.
So, what is the average age group of getting blood cancer?
Across all ages, you can get cancers in all ages, but commonly these are seen, acute leukemias are seen in children. The Hodgkin's and the non-Hodgkin's lymphomas are seen in age around less than 60 years, whereas the chronic leukemias are seen in age more than 60 years. The chronic leukemias again are of two types, CML and CLL. A CML needs one of the tyrosine kinase inhibitors. CLL needs different types of drugs based on the stage. So you have this disease across all ages. There's commonly said it is common in young, the acute leukemia.
Okay.
Around
Thank you.
25% of cancers in children are acute leukemias.
Okay. So thank you so much, Doctor, for coming to our show and sharing your valuable time and insights with us at Medicircle. And it has been a pleasure having you on the show.
Thank you, madam. It was a pleasure speaking with you too. Hopefully, a lot of people do get an awareness about cancer and they spread the word about it. And what we see is children, they are sometimes, when they have joint pains, they go to take painkillers. 15 days later, they go to a rheumatologist, meaning a different doctor, who will treat the joints and the aches in the joint. After 5-6 months of methotrexate, they'll come to us. So these programs are needed for giving more awareness. And thank you for taking the initiative.